Hi, James Boys here, and welcome to my channel, which is looking at all things around pathology in healthcare. I'm going to make sure that I bring you up to speed with some of the latest publicly available news regarding pathology, but also drug treatment discoveries. We live in very exciting times, and so I want this first video to essentially be a quick introduction to pathology specifically and the departments that comprise the topic. When you or a relative are sick and you visit a GP or physician's office in the community or attend a hospital environment, it's highly likely that a blood test or other component of pathology will be called upon to provide you with a diagnosis. So without further ado, let's explore this area with a quick run through. What is pathology? So pathologists play an important role in disease diagnosis, prevention, treatment and monitoring. If you've ever had a blood test, cervical smear or tissue biopsy, a pathologist will have been involved in your care. It's around 70 to 80% of all diagnosis for pathology is used in order to treat diseases and give you diagnoses. In the UK, hospitals and a small number of private pathology groups provide pathology services, and to give you some idea of the scale, as you can see here, it translates to over 1 billion tests a year. That costs roughly £2.2 billion for the NHS alone. In Australia, it's 500 million tests per year, with a little less than half the population of the UK, so it's roughly similar on a per person basis. Major advances have been made by pathologists, from breakthroughs in the successful treatment of cancer and the safety of blood transfusions to treatment for inherited conditions and vaccinations against infectious diseases. And as you can see here, there are 19 different disciplines, and they're given here on this next slide. Now, I'm not intending to go through every single one of these disciplines with you on this presentation today, but we will pull out the major ones that you're going to be coming across within the area of pathology. So without further ado, we'll jump right in with the clinical biochemistry, chemical pathology. So chemical pathology, clinical biochemistry, involves the biochemical investigation of bodily fluids such as blood, urine and cerebrospinal fluid. By discovering how and where the body's chemistry has changed, diseases can be diagnosed and monitored. That's because many illnesses are reflected in the disturbance of the body's chemistry. Chemical pathology brings together science and medicine, therefore. By understanding the chemistry of bodily fluids and monitoring these, laboratory professionals can tell whether a patient's organs are working properly, diagnose diseases, and recommend treatment. So an easy example could be where a result shows high blood sugar, known as glucose, in the blood as an early sign of diabetes. Point of care testing also falls usually within this area. So many clinical biochemistry tests can now also be performed at the patient's bedside or in their home, and that is essentially what point of care testing is. But it has the advantage that patients don't have to travel to the hospital or leave their bed to have the test. The results are therefore usually available immediately, so there's no waiting to find the answer. A really good recent example of this is for women who may find themselves in an emergency situation, but unknown to them are in the early stages of pregnancy. Being pregnant alters the treatment plans that a woman can receive. Traditionally, a urine test is used, but collecting a sample from a woman in an emergency setting can be pretty difficult, especially if she's dehydrated, in pain, or maybe even unconscious. Now there's a simple new blood test which can rapidly and accurately help detect the hormone that is usually used to determine whether a woman is pregnant. The test shows very quickly if a woman is in the early stages of pregnancy by measuring very low levels of the hormone in just 2 to 3 drops of blood using a handheld instrument within 10 minutes. Pretty amazing. So moving on, hematology, which involves the diagnosis and treatment of patients who have disorders of the blood and bone marrow. So for example, people with serious life-threatening illness such as cancers like leukemia, lymphoma or myeloma that require chemotherapy. Hematology is the specialty responsible for the diagnosis and management of a wide range of benign and malignant disorders of the red and white blood cells, platelets and the coagulation system in adults and children. Haematologists are the pathologists who receive the blood samples from GP surgeries and check them for abnormalities. The diagnosis can be done within a few hours, since in some cases treatment must be started immediately. Some haematologists are involved also in blood transfusion medicine, ensuring that adequate stocks of safe blood are available when needed for blood transfusions. They can confirm which donated blood is the right match for the patient's blood group. So let's jump right to that topic next. So transfusion medicine. This is actually the most highly regulated area of a laboratory, and all countries have very high standards applied to this part of pathology. This is in no small part due to the fact that ignoring clear guidelines can result in people being given incorrect blood, and in the worst case, that will actually kill them. Transfusion medicine, also called blood bank or blood transfusion, is the use of transfusion therapy to treat patients with a variety of conditions including cancer and leukemia. Consultants in transfusion medicine are generally trained in collecting, separating and storing blood and its components, donor management, patient care, stem cell collection, cellular therapy and coagulation. On this slide you can see the different blood types, along with the antibodies and antigens that can exist in each group. Blood transfusion practice has revolutionized modern healthcare, playing a vital role in the treatment of many different patients, such as those with life-threatening injuries. The practice of transfusion medicine involves not only taking donated blood and transfusing it to patients, but also conserving blood to ensure that it's available for those who need it. Blood, believe it or not, is the most expensive resource in a hospital. Although advances have been recently announced where they can create blood, with 2 separate studies in 2017 alone showing researchers successfully creating blood stem cells in a lab setting for the first time, today blood comes from volunteer donors. So if you can, go and explore whether you can do blood donation at your local hospital. Microbiology next. So this is actually a really fascinating area in the labs right now. Some of you may remember in biology classes at school being given a petri dish or an agar plate and a swab and told to go and take a sample from the toilets and put the dish into a small oven at a set temperature to watch what grew on the agar. Well, believe it or not, microbiology labs were doing that same process up until quite recently, all by hand. So what is microbiology? Traditionally, it is a major discipline, but is broken down into virology, immunology, toxicology and bacteriology. Sometimes people refer to just bacteriology as microbiology and put the other areas into core sciences which sit alongside haematology and biochemistry, and that's largely because the other parts of microbiology are numerical, whereas bacteriology uses words and descriptions. At a high level, microbiology is involved in the diagnosis of infection caused by bacteria, fungi, parasites and viruses, identification of the best treatment options for infection and the monitoring of antibiotic resistance. It also includes testing how well a patient is responding to treatment of infection. One of the most important roles of the microbiologist is to ensure that the antibiotics are prescribed and used appropriately. Microbiologists are also on the front line of identifying new superbugs and have a major role in the research of new antibiotics. They obviously also play an important role in infection control, trying to stop infection spreading from one patient to another. It's worth noting that antibiotics are drugs used to treat bacterial infections. That means they're not effective against viruses. So what's new here? Well, a couple of years back, we saw the introduction of automation to the bacteriology lab, where robotics that was commonplace in the fields of those core sciences like haematology and biochemistry was introduced. Today, there's actually a big discussion taking place about even replacing this type of robotics with something called PCR. PCR is an abbreviation for polymerase chain reaction. PCR is a method for amplifying DNA. So if you have one molecule of DNA, you can increase it to thousands of molecules within just a few hours. That's why it's exciting, because as we said at the start, to grow something on a dish sometimes takes as much as 3 days to do. So if you're dealing with a suspected meningitis case, you certainly can't wait that long, because the patient has very little time between that initial infection and possible death. So watch this space, could be rather exciting. Next up, cellular pathology. Histopathology, or cell path as it's sometimes called, is the combination of both histology and cytology. So for any ladies watching this, an example of something familiar here is your smear test to spot early signs of cervical cancer as just one example component of cytology. These disciplines combined cover the diagnosis and study of diseases of the tissue and involve examining tissue and cells under a microscope. Histopathologists are responsible for making tissue diagnosis and helping clinicians manage a patient's care. They generally work closely with other clinical specialties. They can reach a diagnosis by examining that tissue from the skin, liver, kidney, or another organ. This is called a biopsy. They examine the tissue carefully under a microscope, looking for changes in cells that might explain what is causing a patient's illness. There are 20 million histopathology slides examined in the UK each year alone. Essentially, their other main role and responsibility is to provide a diagnostic service for cancer. They handle the cells and tissues removed from suspicious lumps and bumps, identify the nature of the abnormality, and if malignant, provide information to the clinician about the type of cancer, its grade, and for some cancers, its responsiveness to certain treatments. With rapidly changing developments in molecular pathology, pathologists are leading the way with new techniques, such as something called fluorescence in situ hybridization, shortened to FISH for short, and then PCR. You'll remember that abbreviation from when I was talking about microbiology earlier, the polymerase chain reaction. And it maps genetic material in tissues or tumours which are essential in the management of many cancers. It's been several years in evolution, but slowly we're seeing the advance of digital pathology in this area. That is, using digital images of tissue mounted on slides rather than using the traditional microscopes on a per-user basis. By making these slides digital means that getting a second opinion from specialists that aren't in the same building or even hospital or even country actually becomes possible. It's obviously the other main driver for this is that it's becoming critical for certain fields of histopathology to ensure valuable resources are utilised whenever possible for certain interesting cases, and this is because we're having currently globally a number of histopathologists reaching retirement, so there are certain shortages in parts of the area. The world, though, is getting smaller, which brings me neatly into the final section we're going to cover today, genetics. Genetics has come a long way in recent years to start to become a key component of pathology. This is largely because it's very complex with many unknowns and is also very costly. We recently celebrated the sequence of the human genome to be less than $1,000 American. A blood test, to give you an idea, is a fraction of that price. This is the branch of biology linking the study of genetic inheritance with the study of cell structure, especially for human chromosome analysis and the detection of inheritable diseases. Cytogenetics involves testing samples of tissue, blood or bone marrow in a lab to look for changes in chromosomes, whether they're broken, missing, or if there are extra ones. Molecular genetics is another branch, which is the study of the processes where biological information is stored, copied, repaired and decoded to create protein and other molecules within cells and tissues. This influential area of bioscience contributes significantly to expanding our understanding of biology and allows us to develop bespoke diagnosis, treatment and disease prevention for each patient based on their own genetic makeup. You can expect to see quite a lot of detail about this area on this channel in the future. And that wraps it up for today. So I hope you've learned something, and I look forward to sharing some more exciting information in this area on the next video. Thank you.